A PCT is helping a patient with limited mobility move from the bed to a wheelchair. The PCT should first A. Position the wheelchair directly in front of the patient. B. Lock the wheelchair brakes and move footrests aside. C. Ask another PCT to lift the patient without assistance. D. Have the patient hold the PCT's neck for support. Answer: B. Locking brakes and moving footrests prevents falls and ensures safe transfer. When assisting a patient with bathing, the PCT notices redness over the patient's tailbone. The PCT should A. Ignore it, as it's normal for older skin. B. Massage the area to improve blood flow. C. Report it immediately to the nurse. D. Apply powder without telling anyone. Answer: C. Redness over bony areas can indicate early pressure injury. Prompt reporting is required. The best way for a PCT to confirm a patient's identity before drawing blood is to A. Ask, "Are you Mr. Ahmed?" B. Check the patient's ID band and ask them to state their full name and date of birth. C. Ask a family member to confirm the patient's name. D. Look at the chart and assume it matches the patient. Answer: B. Using two identifiers prevents errors and ensures patient safety. When collecting a urine specimen, the PCT should A. Label the container after the specimen is collected and before leaving the room. B. Label the container before collection and keep it at the nurse's station. C. Pour the specimen into any clean container. D. Ask the patient to keep it until the nurse arrives. Answer: A. Labeling immediately after collection ensures correct identification. If a patient begins to fall while being assisted to walk, the PCT should A. Hold them upright no matter what. B. Lower them gently to the floor, protecting their head. C. Step back to avoid injury. D. Pull them toward the nearest chair quickly. Answer: B. Safely lowering prevents injury to both patient and PCT. When taking a patient's blood pressure, the PCT should position the patient's arm A. Below heart level. B. Above heart level. C. At heart level and supported. D. Hanging freely at the side. Answer: C. Correct arm positioning ensures accurate readings. A patient refuses their scheduled vital signs check. The PCT should A. Document the refusal and inform the nurse. B. Record estimated values. C. Take the readings while the patient is distracted. D. Ignore it and try later without documenting. Answer: A. Patient rights allow refusal, but documentation and reporting are required. While feeding a stroke patient with weakness on the left side, the PCT should A. Place food on the patient's weak side. B. Place food on the patient's strong side. C. Offer liquids only. D. Avoid feeding the patient altogether. Answer: B. Placing food on the strong side helps with chewing and swallowing. The first step in using an automated external defibrillator, AED, is to A. Apply the pads to the chest. B. Turn on the AED. C. Deliver a shock immediately. D. Call the manufacturer. Answer: B. Turning on the AED allows it to guide the rescuer through the process. If a patient starts choking and cannot speak or cough, the PCT should A. Give abdominal thrusts. B. Offer water to help clear the airway. C. Call housekeeping for assistance. D. Wait to see if the patient clears it. Answer: A. Abdominal thrusts, Heimlich maneuver, can dislodge the obstruction. When documenting intake and output, the PCT should A. Record only fluids consumed during meals. B. Include all fluids, for infusions, and tube feedings. C. Estimate amounts visually without measuring. D. Document only when the nurse requests it. Answer: B. Accurate intake/output includes all fluids to monitor hydration. A PCT finds a patient lying on the floor with no visible injuries. The first action is to A. Help the patient back into bed. B. Check for responsiveness and call for help. C. Document the fall without telling anyone. D. Ask the patient why they fell. Answer, B. Safety and immediate assessment come before movement. To reduce the risk of infection when performing patient care, the PCT should: A. Use gloves for all tasks. B. Wash hands before and after patient contact. C. Wear a mask at all times in the facility. D. Avoid touching the patient. Answer, B. Hand hygiene is the most effective infection control measure. When transferring a patient using a mechanical lift, the PCT should: A. Move quickly to avoid patient anxiety. B. Ensure the sling is applied correctly and securely. C. Operate the lift alone without checking safety. D. Leave the patient in the lift for short breaks. Answer, B. Proper sling placement is essential for safety. A PCT is collecting a fingerstick blood sample. The puncture should be made: A. In the center of the fingertip. B. On the side of the fingertip. C. At the base of the finger. D. On the nail bed. Answer, B. Side punctures reduce pain and promote blood flow. Before assisting with ambulation after surgery, the PCT should: A. Check the patient's surgical site. B. Ensure the patient has non-slip footwear. C. Ask the patient to stand without help. D. Skip the gait belt if the patient feels strong. Answer, B. Non-slip shoes prevent falls. When using a gait belt, the PCT should place it: A. Around the patient's chest. B. Over clothing around the waist. C. Directly on bare skin. D. Around the patient's neck. Answer, B. The belt should be over clothing at the waist for comfort and safety. The safest way to prevent strain when lifting is to: A. Keep feet close together and bend from the waist. B. Use leg muscles and keep the back straight. C. Twist the torso while lifting. D. Lift quickly without pausing. Answer, B. Proper body mechanics prevent injury. A patient with dementia keeps removing their oxygen cannula. The PCT should: A. Tie the tubing tightly. B. Inform the nurse and monitor closely. C. Ignore it since they're breathing. D. Apply a mask without telling anyone. Answer, B. Changes in behavior and oxygen use must be reported. When emptying a urinary drainage bag, the PCT should: A. Touch the drainage spout to the container. B. Keep the spout above the collection container. C. Avoid letting the spout touch the container. D. Drain it into a sink. Answer, C. Avoiding contact prevents contamination. While measuring a patient's pulse, the PCT counts 20 beats in 15 seconds. The pulse rate is: A. 60. B. 80. C. 120. D. 140. Answer, B. Multiply beats in 15 seconds by 4 to get beats per minute. Before collecting a stool sample, the PCT should instruct the patient to: A. Urinate first to avoid contaminating the sample. B. Avoid washing hands after collection. C. Mix stool with toilet water. D. Keep the sample for 24 hours before giving it. Answer, A. Urination first prevents contamination. When assisting a patient with oral care who is unconscious, the PCT should: A. Use large amounts of water to rinse. B. Keep the patient flat in bed. C. Position the patient on their side. D. Use toothpaste with alcohol. Answer, C. Side-lying position prevents aspiration. While applying anti-embolism stockings, the PCT should: A. Roll them down to the ankle before applying. B. Smooth out wrinkles for proper circulation. C. Put them on over shoes. D. Apply them while the patient is standing. Answer, B. Wrinkles can restrict blood flow. When documenting in a patient's chart, the PCT should A. Use personal opinions about the patient's behavior. B. Record only what was observed and done. C. Write in pencil to allow changes. D. Include unrelated patient information. Answer, B. Documentation must be factual, objective, and relevant. To ensure accurate weight measurement, the PCT should A. Weigh the patient at different times daily. B. Weigh at the same time each day with the same scale. C. Allow the patient to hold on to furniture. D. Ignore the need to remove heavy clothing. Answer, B. Consistency ensures accuracy. When performing perineal care, the PCT should A. Wash from back to front. B. Wash from front to back. C. Use the same cloth for all areas. D. Skip drying to save time. Answer, B. Front to back washing prevents infection. A patient with a nasogastric tube says they feel short of breath. The PCT should A. Encourage deep breathing and ignore the tube. B. Stop feeding if in progress and inform the nurse. C. Remove the tube immediately. D. Tighten the tube to prevent movement. Answer, B. Shortness of breath could indicate tube displacement. When assisting with postmortem care, the PCT should A. Handle the body roughly to save time. B. Maintain dignity and privacy at all times. C. Avoid wearing gloves unless necessary. D. Skip care if the family is present. Answer, B. Respect is essential even after death. During a 12-lead ECG, the PCT notices the patient is shivering. This may A. Improve the tracing. B. Cause artifacts on the ECG. C. Stop the heart rhythm. D. Increase heart rate dangerously. Answer, B. Shivering can interfere with signal quality and cause artifacts.